Curious as to how Telecare develops program budgets? Everything starts with a customer contract. Most of Telecare's contracts are with counties, state, and commercial insurance payers. The contract will dictate what services Telecare provides and how services are provided to clients. The agreement states how many members we can provide services to and how much money we will receive when the services are provided. It also details how much money we receive annually, what that money is allowed or not allowed to be spent on, and how many staff by job title we are allowed to hire. Any deviation from the contract requires prior approval from the customer, or the expenses could be excluded from the customer's reimbursement. Funding for Telecare programs comes from 4 primary sources. County general funds raised from fees and taxes. In California, the Mental Health Services Act is a major source of funding to help pay for behavioral health services. Government programs like Medicare and Medicaid. Commercial insurance plans like Kaiser or United Healthcare. Clients with income who are required to pay for a portion of their services. As most of Telecare's funding comes from county, state, and federal funds, spending of these funds is highly regulated. Each year, Telecare participates in numerous fiscal audits where we are required to detail through records how these government funds were spent. As such, we must act in a fiscally responsible nature. At Telecare, we pride ourselves in being judicious with our spending and developing detailed budgets. Telecare's fiscal year runs from July to June. Telecare's annual budgeting process starts in early February and wraps up in early June. An accurate program budget is critical to ensuring the program operates within the guidelines of the contract. All program budgets have the same components. These components include revenue, wages and benefits, services and supplies. Let's break it down further. A program's revenue budget is based on the amount of funding available, the estimated amount of services to be provided, and the rate the customer will pay for each service. Wages. Telecare calculates the wage budget based on the number of staff the program needs to provide the contracted services and the rate anticipated to be paid to staff in the next fiscal year. Telecare starts with the current rates paid to staff when estimating the rate anticipated to be paid. Then, we coordinate with the compensation group to evaluate the external marketplace and any anticipated regulatory changes. Benefits. Benefit costs include payroll taxes, group health insurance, and retirement plan expenses. Services and supplies. Services and supplies include all the general costs incurred while running a program. These expenses include, but are not limited to, rent, training, travel, mileage, meals, cell phones, food for clients, and general expenses. How does Telecare get paid? By billing its customers. Telecare has a diverse customer base and diverse billing methods. Some billing processes are relatively automated, and others require significant manual work. It's important to note that you are critical in whether Telecare will get paid for what we invoice our customers. Ensuring all authorizations are received before services are delivered. Ensuring services are documented correctly, and promptly entering services into Telecare/county systems are all critical steps to ensure Telecare gets paid. Additionally, ensuring funds are spent appropriately with supporting documents like receipts is critical to ensuring proper payment from customers. Any errors along the way, from a service being delivered to a service being billed or expense documents not being maintained, delay Telecare receiving payment and can significantly impact our ability to sustain operations. So, where does all the money go? Telecare is a for-profit company that operates in a non-profit environment, and the profit we earn is reflected as such. The illustration below shows how every dollar earned at Telecare is spent. Telecare's ability to earn a profit is critical to supporting our mission, investing in systems and processes that enhance our service delivery, and investing in our employees.